Ventilation and perfusion imaging of the lungs is used to detect pulmonary embolisms and the percentage of total perfusion and ventilation attributable to each lung. Ventilation imaging of the lungs shows the regional distribution of inspired air throughout the lung tissue and the uptake and clearance dynamics of the lungs by having the patient inhale a radioaerosol or gas. Pulmonary ventilation imaging, e.g., aerosol or gas. The patient is usually placed supine and breathes in a radioaerosol or gas through a tube that is attached to a nebulizer. Once the aerosol or gas is inhaled, the radioactivity stays in the area where it was deposited long enough to take images with a camera that detects the gamma radiation being given off from the aerosol or gas in the air spaces. Pulmonary perfusion imaging, e.g., Particulate. Nuclear pulmonary perfusion imaging uses a venous injection of radioactive macroaggregated albumin particles that are too large to pass through the pulmonary capillary bed and accumulate there as they are strained out. A scintillation or gamma camera takes planar images on computer screen or film by detecting the gamma radiation from the radiopharmaceutical in the lungs as it scintillates or gives off energy in a flash of light when coming in contact with the camera's detector. Localization of the radioactive particles is proportional to the blood flow and thereby maps lung perfusion. Standard perfusion imaging usually consists of 8 planar images from different projections, with the posterior oblique views being most important since they image the lower lobes, the most common site for pulmonary embolism. Pulmonary ventilation, e.g., aerosol or gas, and perfusion imaging. Perfusion imaging is done after a venous injection of radioactive macroaggregated albumin is given to the patient. The albumin particles are too large to pass through the pulmonary capillary bed and accumulate there as they are strained out. This localization of particles is proportional to the blood flow and thereby maps lung perfusion. A nuclear ventilation image is obtained to complement the perfusion image. For a single breath image, a posterior view of the thorax is taken as the patient inhales radiolabeled xenon gas in a single breath and holds it as long as possible. This image obtained from the gamma camera that detects the radioactivity from the gas in the lungs shows well-ventilated areas having uniform activity and poorly ventilated areas with decreased or absent radioactivity. Quantitative differential pulmonary perfusion, including imaging when performed. And ventilation, e.g., aerosol or gas, including imaging when performed. Perfusion imaging uses an injection of radioactive albumin, which are particles too big to pass through the pulmonary capillary bed and accumulate there, mapping blood perfusion as they are strained out. Standard perfusion imaging usually consists of 8 planar images from different projections, the most common site for pulmonary embolisms. The 2 types of images complement each other for diagnosis purposes. When the data for these studies are acquired on a digital computer, lung perfusion and ventilation can be quantitated for gradient comparisons and function differential calculations. Report 78,597 for pulmonary perfusion testing only. Report 78,598 for pulmonary perfusion and ventilation testing. Brain imaging, less than 4 static views. With vascular flow. Brain imaging, minimum 4 static views. With vascular flow. Brain imaging, vascular flow only. Cerebrospinal fluid flow, imaging, not including introduction of material, cisternography. A lumbar puncture is necessary to inject the radiotracer into the lower spinal canal region. A scintillation or gamma camera takes planar images of the study area on computer screen or film by detecting the gamma radiation from the radiopharmaceutical in the body tissue as it scintillates or gives off energy when coming in contact with the camera's detector. Cisternography is a multiple-day procedure requiring 6-hour, 24-hour, and 48-hour scan sessions. Cerebrospinal fluid flow imaging, not including introduction of material, ventriculography. Diagnostic nuclear ventriculography is done to measure ventricular size in the brain. A lumbar puncture may be necessary to inject the radiotracer into the lower spinal canal region, or it may be injected into a reservoir or valve of the shunt. A scintillation or gamma camera takes images of the study area on computer screen or film by detecting the gamma radiation from the injected radiopharmaceutical. Cerebrospinal fluid flow imaging, not including introduction of material, shunt evaluation. In order to detect any malfunction and assess the shunt's patency in a non-invasive manner, a radiotracer is injected into a reservoir or valve of the shunt. A scintillation or gamma camera takes images of the head, chest, and abdomen by detecting the radiation from the injected radiopharmaceutical to determine the movement of the tracer from the shunt in the brain to the peritoneal cavity. Cerebrospinal fluid leakage detection and localization. A lumbar puncture may be necessary to inject the radiotracer into the lower spinal canal region. A scintillation or gamma camera takes images of the study area on computer screen or film by detecting the gamma radiation from the radiopharmaceutical to detect fluid levels in sinuses that suggest leakage and determine the leakage location. Radiopharmaceutical dacryocystography. Dacryocystography is the radiographic evaluation of the lacrimal system to localize the site of an obstruction. In diagnostic nuclear medicine, a drop of a radiotracer is instilled in the eye and subsequent imaging by a scintillation or gamma camera is performed to follow the passage of the radioactivity and the rate at which it disappears into the lacrimal system to assess if there is a stone or other blockage that interferes with normal tearing function. Kidney imaging morphology. For kidney imaging, a radionuclide such as 99-MTC-DMSA is chosen because it will travel to the kidney and remain in the functional tissue there. It is injected into the patient and a scintillation or gamma camera takes planar images of the kidney on computer screen or film by detecting the gamma radiation from the radiopharmaceutical in the renal tissue as it scintillates or gives off energy in a flash of light when coming in contact with the camera's detector. Kidney imaging morphology, with vascular flow. For diagnostic nuclear imaging of the kidney with a vascular flow test, the radionuclide 99-MTC-DTPA is commonly chosen because it will follow the blood as it flows through the kidney and also identify any obstruction in the collecting system to determine the rate at which the kidneys are filtering. It is injected into the patient and a special scintillation or gamma camera takes planar images of the study area on computer screen or film by detecting the gamma radiation from the radiopharmaceutical as it flows through the kidney. Urethral reflux study, radiopharmaceutical voiding cystogram. Fluids are given into the bladder for half an hour through a Foley catheter and posterior images of activity are taken. According to the patient's need, the bladder is emptied while digital recordings are taken to the end of voiding and continued for another few minutes. Urinary bladder residual study. For a urinary bladder residual study, the patient is injected with 99-MTC-DTPA to evaluate for obstructions or non-compliant bladder. Images are obtained with a gamma camera to record bladder activity for a set amount of time before voiding. The bladder is emptied and the volume that was discharged is measured. Bladder activity is re-imaged for the same length of time after voiding. The residual urine volume is calculated using the amount of urine passed and the bladder counts both before and after voiding. Testicular imaging with vascular flow. For testicular diagnostic nuclear imaging, 99 mtc per technetate is injected into a vein in the arm and travels to the testicle where it accumulates. In a vascular flow test, the radionuclide labels red blood cells and therefore goes wherever the blood flows. A scintillation or gamma camera takes images of the study area on computer screen or film by detecting the gamma radiation from the radio tracer concentrated in the testicle or the blood as it flows through the testicle.